Healthcare, everybody's talking about it. The problem is nobody knows exactly what we're talking about because the process for developing a healthcare bill here in the Senate frankly stinks. There haven't been any hearings, there hasn't been any open discussion. Only a small group of Republican senators know what's in the bill. It hasn't been shared, and we haven't gotten any responses from anybody outside. This is really complicated and important stuff. It's 1/6 of the American economy, and there's this rush to get it done in the next couple of days. We're going to have probably hours to digest it and try to decide how to vote on it. What worries me is that the House bill apparently was the basis for where they started to work in the Senate, and the House bill is frankly awful. It's awful for Maine. It's awful for particularly seniors in Maine. There are going to be cuts all over the place and increased costs for particularly people over 50 for their health insurance. And well, the president characterized it as a mean bill. I characterize it as cruel. I would tend to agree with him with his assessment. I don't know what the Senate's going to be able to do, but if the centerpiece of the Senate bill is the same as the centerpiece of the House bill, we're in trouble, because that centerpiece is a massive tax cut for the wealthiest Americans. That seems to be what this is all about. It's a tax cut disguised as healthcare reform. And once you take over $1 trillion out of the healthcare system, there are going to be consequences. People are going to lose coverage. Coverage is going to become more expensive. And in Maine, we know there are going to be economic effects. In 8 of our 16 counties, the hospital, the local hospital, is the largest employer. I've met with probably at least half a dozen of them, and they've all told me that if something like the House bill passes, they're going to have to lay people off. They may even have to close, and that's going to be a loss of access and a loss of jobs. So all of the pieces on this are just wrong, and it's being done in the wrong way. We can do better around here. We can openly debate and discuss and take some time and understand what the ramifications are. But to vote for a bill like this without really fully appreciating the consequences, I don't get, and it's certainly not what I intend to do. So I'm going to assess and see what they come up with in the couple of days that we're going to have to review it. But I'm not optimistic based upon what the House bill does, and also based upon the underlying premise, which is to take a lot of money out of helping people in America to get health care.